Maybe you could just give me a general overview, Mike, about what the CDC's been doing down here since the earthquake.
Sure. I mean, so the CDC maintains an office here in country, and it's mainly focused on HIV and AIDS programs. So specifically after the earthquake, it was disaster response, and then my group has been focusing on infectious diseases, both surveillance, the epidemiology, and then the laboratory science, the microbiology of it, the testing, the receiving of the results. So to do that, we've been working with the Ministry of Health, who has a great system in place. So we've just been kind of working with them to initiate a surveillance, both epidemiology and laboratory based, to get an idea of what's going on after the quake, and then to try and get an idea of if diseases and incidences are changing.
And for you specifically, what does that kind of look like? I think a lot of people don't understand kind of like, what does it mean to set up a surveillance system? Kind of a day in the life for you, what's it been like in the last couple of days?
Right, so for me, it's kind of a two-tiered system where you have the epidemiology side of it, where doctors say, hey, I'm seeing these cases, I'm concerned about these patients, these diseases. So the epidemiologists really focus on that, and is there a change in these rates? Are they concentrated in one area? But for me, the focus is on the laboratory science side. So to say, of these patients that we're concerned about, this one has disease A, this one has B, and to try and really confirm and to work with the epidemiologists to really nail down what it is we're seeing, and then to try, if we do see outbreaks, which is primarily what we're concerned with, to try and have the laboratory side help guide the epidemiology side, to kind of fix these sorts of items.
We talked about it a bit last night, but I mean, CDC has a lot of resources, had a lot of kind of big level resources they can throw at something like this, but how do you measure the impact? I mean, what kind of impact do you think the CDC has had, or what kind of impact do you think the things you've done now could have or will have going forward?
Yeah, that's a tough question to really answer, because things are in a constant state of flux, and we're still in a disaster area. So the model for how are you impacting is kind of difficult to measure. For me, it's making sure that the laboratory feels like they're able to deal with whatever they're seeing and coming in, and making sure that the data we see and the science we do are worthwhile, and that they provide a utility to the ministry. And I think we've achieved that. It's slow going, and it's day by day, but you just ratchet away at a problem, and it's tough to measure, but I think we're doing it.